Rampton Hospital is one of 3 high secure hospitals in England. There's one in Scotland, which is much smaller, but we also at Rampton provide services that cover Scotland and Northern Ireland and Wales.
There's around 300 patients, 300 plus patients. It does fluctuate, and they are spread across 26 wards.
We have a women's service that provides services to women from England, Scotland, Northern Ireland and Wales, and we have 50 beds in the women's service, and that is an entirely women-only campus for patients. We do have a mix of male and female staff, but it's a very safe area that the women only live within.
We've also got the national service for men with a mental health problem who are deaf, so that's a very small service of 10 beds, and we've got the national high secure service for people with a learning disability for men. We've also got a discrete service within the women's service for women with a learning disability, but that's a very small number.
A very large site. It's a hospital for patients that need a high level of care and support and have high levels of risk. Very different to what people expect. When people come here, they often expect it to be either like a prison or very austere and quite closed. And actually, it's a very open site. There's a lot of green areas. There's a lot of opportunities for people to experience different things on the site. So we have a swimming pool, we have a shop, we have lots of different activity areas, and each of the wards has its own character and clinical team. We have a physical healthcare centre which provides physical healthcare across all of the areas.
So all of our patients will be detained under the Mental Health Act. They may or may not have committed an offence. We're part of the NHS, so we are a hospital first and foremost. Whilst we're high secure, we're not a prison.
We also have a framework that's called the security directions, and they're laid down by the government and are very strict rules that high secure hospitals have to work within. Very clear, not just guidelines, but they are things that we have to achieve. We have to have a certain specification for the fence. We have to have things like the way mail is processed, the way staff and visitors come in and out of the hospital, the way patients experience the hospital in terms of what they can and can't have. For example, IT equipment is very regulated within the directions, and things like mobile phones cannot come in the hospital. So there's a lot of rules and regulations that come from either the security directions or from being detained under the Mental Health Act.
There are 3 elements of security. There's the physical security, which are the locks, fences, gates. There's the procedural security, which are the policies that we expect our staff to follow. And then there's the relational security, which essentially is the detailed knowledge that our staff and our clinicians have and the relationships that we have with the patients that help us to manage risk. The people who come to Rampton have spent time in other settings where they may have presented significant risks, and the combination of their mental health problem and the risk that they present is where our work begins. There's an average length of stay of 5 to 7 years. The packages that we have are very much individualised, and the care that they receive is tailored to their specific needs.
There is a difference between here and other hospitals in terms of the level of scrutiny that we have from external. So from the government, there's a line of sight to all the way to the Prime Minister, the Health Secretary, the Home Secretary. So there is a very much a bigger scrutiny than you would have in any other type of hospital. Simple things like a lot of hospitals will not have locked doors, locked bedrooms at night, those type of settings and situations. However, we are the same as other hospitals in terms of the way we care for people. We have ward staff that are nurses, they're not prison officers. We have qualified nurses, we have qualified OTs, we have medical staff. Everybody has their own doctor, their own nurse, their own specialists in lots of areas, psychology. We have things like horticulture where patients can go and grow vegetables and feed the chickens, which is something more than you'd possibly get in another hospital. So we are the same as the hospital in some ways, but very different in others.
Initially, when I heard my son was destined for Rampton, it was head in hands, and what has he done now? As time went on, yes, it was very good for him. And I have to say that Rampton actually did save his life. He was settled in little or no time and well cared for. You've got to remember that Rampton is a very specialised hospital, and they have guidelines that must be adhered to. I would say anybody who would have somebody come into Rampton for the first time, the nerves you feel, the jitters, that's a horrible, notorious place. It's not. Rampton is quite the opposite.
I think the ethos is about recovery. It's about helping people to recover hope and maintain hope in what can be very difficult and challenging circumstances. So we want to get to a position where they reach their optimum level of functioning. Our plan is to always get them to the next level of security and ultimately to get them to the community and independence.